So I've been a registered nurse for 6 years and a nurse practitioner for 2 years. My very first job out of school as a registered nurse was actually on an orthopedic and spine floor in Florida. And then I moved back to New York and started working as a diabetes educator at a pediatric endocrinology center for 4 years. I myself have type 1 diabetes, and so working with diabetes and having diabetes was very exhausting. And so I decided to completely change up my specialty and leave endocrinology, and I was looking for a challenge when I graduated nurse practitioner school. So I saw a job posting for pain management and spine on Indeed, and I came in for an interview, and as soon as I met Dr. Patel, I knew that she would be a great doctor to teach me how to be a nurse practitioner, because once you're in practice, that's where you learn everything. So I decided to accept the job offer and start working in a completely different specialty, unknown to me. So a lot of patients ask the difference between like a PA and nurse practitioner. As a nurse practitioner, we've had experience bedside. We've been nurses. You know, I was a nurse for 6 years before 4 years before I went to nurse practitioner school. So I had the experience, with patients and speaking with patients. So we're responsible for formulating a plan of care for the patient, which is a very different role than a registered nurse. As a registered nurse, we kind of take orders from doctors and we just do them, whether or not we agree with them or not. As a nurse practitioner, we're really autonomous, and we get to really develop the plan of care for the patient. So we're from A to Z, we're there for the entire step of the way, and we get to see the patients through the entire journey. The way that our practice runs, the patient gets to interact with so many different providers throughout their visit. So although it's sometimes annoying for the patients and they don't like that, it does make sure that we have the full picture of the patient. So we really get to go in and do a full history and physical and really spend time with the patient, when sometimes the doctors are very busy. They're doing injections all day, procedures all day. Since working at Spine and Pain, I feel like we truly are a team effort. I think it has a lot to do with my title as a nurse practitioner, because I have more autonomy now in this position, but something that I always struggled with was the micromanagement in other positions. And so now, being a really collaborative practice and really working together in a huge multidisciplinary team, it comes together and it makes it a seamless, day at work for all of us.